I was going to say, for people who know something's wrong. I mean, sometimes you can tell yourself because, as a friend of mine said, he was working in New York City 20 some years ago. He's driving down the Long Island Expressway on his way home and realized he was falling asleep at the wheel. And that's one question that I got when I went to see a doctor about some of these issues. Are you tired? Do you fall asleep at the wheel? But another part of it is too, if when you realize how many people are just getting their day started with 3 cups of coffee, 3 cups of coffee, that's a clear sign that a great many people just simply are having some sleep issues.
Oh, absolutely. People don't realize that caffeine obviously is probably one that people know about, but alcohol is another one. Alcohol makes you tired, makes you drowsy, but actually will impair your body's ability to have a restful night's sleep. I think we all do a lot of things too in our life that impair or inhibit our ability to have good restorative sleep. For example, how many of our listeners out there probably have a television in their bedroom? Big no no, but I'll bet the majority do. How many of them tend to have their cell phone or their tablet right by the bed, do a little bit of work, do a little bit of reading, uh, something other than sleeping, and that will, in time, train you to not be asleep in the bed. I tell patients the bed is for two things: the bed is for sleep, and the bed is for sex. And if you're not doing one of those two things, you shouldn't be in bed. And that bedroom should be designed to support those activities.
We also are dealing too with a culture that has a lot of unnatural light. The same friend who fell asleep driving home wears one of those masks over his eyes for that very reason. Because the theory is that our ancestors didn't have to deal with street lights or alarm clock lights or all of those things. So now we're sleeping in bedrooms where we have a lot of these glowing lights either coming through the
Absolutely.
window or just next to our beds.
Yeah, and I think our society really depends on a lot of folks to be up at night working when their body is telling them to be asleep. I see a lot of patients who suffer from shift work disorder. And it's not just policemen and firemen and doctors. There are people that work in factories that have to keep that factory running all night. I saw a patient the other day who had been working the night shift for probably 10 years, just wondering why he hadn't yet adapted. And I had to tell him that he wasn't going to adapt. That the body is not designed to do that. We've got this natural sleep-wake cycle, what we call the circadian rhythm. When it's light outside, the brain suppresses melatonin. When it's dark outside, the pineal gland releases melatonin, and we get tired, we get sleepy. When you do anything to go counter to that balance, you're going to have trouble. And I think that's another issue too that we deal with nowadays.
I was going to say, I read a story not long ago that said just in the last couple of 100 years, people used to go to bed and they'd have a 10-hour night, but they'd get up after 4 hours, sometimes for an hour to 2 hours, and then they'd have some clear thinking, and then they'd go back to sleep for 4 hours, and that they'd have that split sleep was actually benefiting them.
I don't know how I feel about that. When we fall asleep, our body passes through cycles. We've all heard of REM sleep, rapid eye movement. Well, the majority of our night is in what's called NREM or non-REM, stages 1 through 3 or 1 through 4, depending on who you talk to. But that third and fourth stage is called slow wave sleep, where we are most relaxed. Our body has the greatest ability to repair, and it takes about 90 minutes to cycle all the way through, including REM. But REM is only about 20% of what we do each night. And if we don't have 3, 4, or 5 complete uninterrupted cycles of 90 minutes, I don't think you can operate at your full potential.
Hold your thoughts there for a moment, Russell. Russell Singleton is a physician assistant at Tripp Family Medicine right here in Twin Falls. This is Better Health with Tripp Family Medicine this morning. On Top Story on News Radio 1310 KLIX and newsradio1310.com with Bill Colley. And we've got more of the program coming up. In fact, Russell can answer some of your questions or comments in the next segment of the program. It's 70 at 840. Our guest is Russell Singleton, physician assistant from Tripp Family Medicine. And he's joining us this week on Better Health with Tripp Family Medicine. And Russell, before we move along, maybe you should tell people if they have an interest in contacting your office, how they go about doing that.
Yeah, give us a call. 933-4400. We do our best to save same day appointments, or next day appointments. You can visit us on the web at Tripp, Tripp, familymedicine.com, or on Facebook.
I was going to say for a lot of people, just because of the growth of this area, there's a need to find someone new. Even if you've only moved from Nevada or Utah, sometimes a lot of people will do that for a couple of years. They'll drive back home to see the old doctor or the old mechanic. And then after a while, you start to say, why am I doing this for 2 hours each way? And so they need someone locally,
Yeah.
and you're welcoming some new patients.
Oh, absolutely. I saw a new patient recently who had a small child with a rash. She couldn't get in anywhere else. She had a regular doctor that wouldn't even return her phone calls. And in a bit of a frenzy, she called asking us, begging us to see her. And of course, we made room for her. We would have made room for her anyways. But it turns out that the rash was actually related to an antibiotic she was taking, and it was a happy ending. But I think we saw her like at 4:30, 4:45 before the end of the day, and that kind of service is harder and harder to find, just based purely on economics. There's more demand than there is supply, I believe.
We were talking off air before we started this morning about sleep apnea. And my famous story or infamous story is the doctor recommended I go see, in fact, it was an endocrinologist, said, you've got to go see, spend a night at the sleep center. So I
Yeah.
went and I had to put on my pajamas and they put me into a bed and they let me sleep for an hour. And then they woke me up and they said, you had 100, it was, I think, 102 episodes in one
After an
hour.
hour, wow.
And I had a friend who had 60 and they thought that was a lot. And so then they gave me I got equipped with a mask, and there's a setting on that for the to force the air. Some people have it higher. I think mine was a 10. Some people I know go up to 25. But no one really paid much attention to this 20 years ago.
That can be true. We were talking about a patient that I had that came in basically presenting in florid heart failure, and we couldn't figure out what it was or what had caused it really. So only after we admitted him to the hospital to try and get that fluid off did one of the nurses notice that he was gasping, that he was choking and struggling to breathe at night. Sleep study, CPAP, he completely turned around. And he's happy, he's at home, he feels great, he looks great, and it was because of undiagnosed and untreated sleep apnea.
And in my case, once I got the mask, I think they said my episodes dropped to about 2 per hour.
That's great. That's great. The goal is zero, obviously, but if you're coming down from 100 events per hour, which for our listeners means that your oxygen levels drop, that you struggle to breathe, from 100 to 2 is amazing. That
And
it really is.
and a lot of people, because of the just that with the pressure you can put in there, obviously do get to zero during the course of the night.
A lot of people do. There is one level above CPAP called BiPAP, where you're not only pushing air in, but you're pulling it back out. People who have significant issues with obstructive sleep apnea oftentimes need a BiPAP. People with central sleep apnea, a rarer form that we don't usually talk about, oftentimes need a BiPAP. And it's interesting that you should mention those sleep studies, and especially how they sent you to a hospital-like setting or a center to do that. Those still exist, and those are still the gold standard. But in recent years, we've started doing more and more home sleep studies, which are not appropriate for everyone. But for the majority of folks that we worry about obstructive sleep apnea, you can do this in your home. And you can do it for pennies on the dollar, where uh, some years ago you'd pay thousands of dollars to do what you did. Now, a couple $100 you can do it at home.
It was like going to a hotel. I mean, it was a beautiful room with all very well appointed, and just a monitor who could track my sleep, and he could speak to me by speaker, obviously, and in the morning after I put the mask on, they let me sleep for another 6 hours. They packed me off and sent me home.
Yeah. And not that this is the point of our conversation, but I've always found it kind of ironic that they send you out, hook you up to a bunch of things, and expect you to sleep normally. They expect you to sleep like you would at home. I mean, who's gonna have a good night's sleep in that kind of setting?
How does it develop? Because most of the people I talk to who've been diagnosed, they're older. We don't find a lot of 25-year-olds, I guess, who have apnea issues.
Well, we can, but I think you're right. Generally, we're looking at older adult males. We look at neck circumference. Anyone with a neck circumference of over 16 and a half inches is at risk. And that's because the increased amount of tissue and the weight can obstruct the airways as you're lying on your back. People who have chronically enlarged tonsils or adenoids are really at risk for this. People who have sinus issues, whether it's allergies or whether it's a deviated septum, uh, there's some obstruction in airflow, and that's what snoring is. Snoring is not normal. It's obstructed airflow. It may be mild, it may be reversible, it may be, for the most part, benign, but it is not normal. And when you pair that with feelings of fatigue and somnolence, non-restorative sleep, falling asleep at the wheel, you've got to get in because it's not just your quality of life. It could be your very life that is at stake.
I had a friend who, and I think a lot of it developed with him because of his work schedule. He worked for the New York Yankees, so there were a lot of late nights at the ballpark, and then he did play by play for a college basketball team in upstate New York, and sometimes the two seasons overlapped. So he was on the road a lot of odd hours. Sometimes would finish a game in one city, get in a car and drive all night to another city. And when he developed some of these sleep issues, he told me that he said that they mentioned he sleeps on his back, but if he had been a side sleeper, it might have been a little better for him. What's he referring to with that?
Well, I do hear that a lot from patients that that position does matter. And I think when you're laying on your back, those soft tissues, whether it's in the neck or the soft palate in the mouth, have a greater ability to fall back and restrict an airway. But if you're laying on your side, the effect is less. So you bring up another good point, Bill, that I kind of wanted to touch on, and that's people who travel a lot, people that have trouble uh, falling asleep given a hectic work schedule, or people that maybe just have an occasional need for a sleep aid. I was hoping to touch on that a little bit today because that is a very common concern. That is a very common request in the office that we prescribe a sleep aid. And that's a very complicated answer. I wish we had more time. Maybe we can touch on that or finish that conversation later. But suffice it to say that there is no such thing as a safe and effective sleep aid for long term use. The American Academy of Sleep Medicine says that the best treatment in reality is behavioral therapy, changing things about your routine, changing things about your diet, about your bedroom. You will not only sleep better, the effects will last longer, and of course, there are no side effects of behavioral therapy.
Going to bed at the same time every night. That's one of the recommendations.
Absolutely. And we do practice what's called sleep restriction to help people get back on rhythm. But having a routine is incredibly important. Whether you're a toddler like my little 2-year-old daughter who we're trying to sleep train right now, or whether you're an older adult, you have to have a routine. You have to ease yourself into bed, and falling asleep or getting into bed at the same night or at the same time every night is part of that. Waking up at the same time every day is part of that. Everyone loves to sleep in, but man, it can throw you off. It can be terrible.
And I'm on an early morning schedule, but I have found since I've been generally going to bed at the same time at night that now, even with that early morning wake up call, I'm sometimes up about 10, 12 minutes before the alarm clock.
Yeah, your body will pick up on that. Your body has a natural rhythm, and when you do anything to fight against that rhythm, which includes going to bed later than usual or waking up earlier or later than usual, your body won't cooperate, and you'll it's an uphill battle.
I think that getting up, the other part of this is I'm still going to bed at the same time weekends and getting up, even though I don't have to get up early in the morning. Getting up, most people wouldn't do this at 4 o'clock on their days off, but I've tried to stay with that pattern because if I were to stay up and watch television till 11 o'clock at night on a Saturday and then sleep till 8 o'clock, 7, 8 o'clock in the morning, I'd have difficulty obviously getting back into that rhythm.
Yeah, you're definitely in one of those professions that can be considered abnormal when it comes to your sleep wake habits. You've got to be up early, and we can't really expect you to change careers just to sleep better. So we've got to work with you in finding ways to help improve your routine, get you to sleep faster, get you sleeping better. And then, of course, if there are things like sleep apnea or restless leg syndrome or um, any other uh, condition, arthritis, frequent urination from prostate issues, from diabetes, whatever, we can correct those. We can try and improve your sleep to the best ability possible. But but you're definitely in a difficult situation like a lot of Americans.
Russell Singleton is joining us in studio. This, of course, is Better Health with Tripp Family Medicine this morning on Top Story on News Radio 1310 KLIX and newsradio1310.com. Bill Colley along with you. It's 8:54, 72 right now. Here's another point to be made. You better have a cool place to sleep in the next few days. If you don't, I mean, I always found on a really hot night, if I didn't have AC going, it was difficult to fall
Oh
asleep.
yeah, dark, cool, and quiet. Absolutely. No electronics. Try and limit fluids, caffeine, alcohol, especially. Another thing I tell a lot of patients is what I call the 15-minute rule. If you're not asleep in 15 minutes, you get out of that bed and you go do something else in a different room, preferably. Go read. If you have to watch TV, I guess that would be okay, but do something relaxing. And then when you're tired, go back and get in bed. You'll be amazed at what you can train your body and your mind to do and to accept.
We have a caller with us, and you're on the air with Russell Singleton on News Radio 1310, KLIX, and newsradio1310.com. What's on your mind? Do I have the caller? Yes, we
I was
do.
working for the Atomic Energy Commission, and they rotated shift over there every month to where we would be on graveyard for a month, and then swing shift for a month, and then day shift for a month. And I remember how really difficult it was to try to adjust. For about the first week, it was almost impossible for me to sleep during the daytime. It was just kind of one of those natural things that when the sun went down, I got sleepy, I went to sleep, and when the sun came up, I felt like I had to go get and do something. I wonder if it was psychological, or if it was some kind of a physical thing that had to be changed in the body nature. But I know a lot of people are still having to live with that scenario now, that their fire departments, their police departments or something, they always get rotated around to a different type of a shift. And that seems to be, I don't know, for the human body to make those kind of changes to start sleeping at all those different hours is kind of a breakdown thing.
I completely agree with you 100%. And my respect for those types of individuals really it increases because of the sacrifices they have to make, including the risk or the wear and tear on their own body. Because you're right, that is not normal. You cannot adjust. You will not adjust to that. You kind of just have to make do, which is where melatonin comes in. We can talk a little bit about that too. I know we're running out of time, but melatonin is really only used or should only be used, in my opinion, to restore that sleep wake cycle. It really doesn't have indication for every night help you fall asleep, and there is absolutely no indication, or at least no official approval for use in pediatric patients, though we do that a lot. I have colleagues in child and adolescent psychiatry that do it a lot. We do it a lot in the office, but never without a full discussion of the risks and without attempting other things. In kids, I know the American Academy of Sleep Medicine says do not prescribe for insomnia because in kids, it's likely related to parent-child interaction, and it just reinforces this idea that we control a lot of those things that negatively affect our health.
I know that my first year out of college, I spent a year working at a hotel during the overnight shift, the night audit, and I would try my best in the morning when I got home. I'd only maybe see an hour or two of daylight. I tried to seal off everything in the room to make it as dark as possible. But one thing I did read about later on was there are some artificial lights you can buy. So even though it's dark when you're awake, sometimes you can have those in the area, and that'll help you, get through the cycle.
I think that's a great idea. In fact, there's some evidence saying that such artificial light can be useful for what we call SAD, seasonal affective disorder. It's true.
I want to thank you for coming by. Russell Singleton joining us this morning from Tripp Family Medicine, located on Fillmore Street across from the main post office. Hey, quickly, for people who'd like to call the office, what's the number again?
933-4400. Give us a call.
We'll talk to either Russell or the doctor or another one of the professionals next week between 8:30 and 9 o'clock in the morning on Wednesday. Meanwhile, we've got news coming up in just a moment from the Fox Radio Network. Also, one more hour of the show ahead. Got a lot to talk about. Bobby Jindal expected to announce for president, maybe in just a matter of minutes. We'll have a follow-up on that as well.